The use of hypnosis for weight loss. How hypnosis represents an effective tool for producing behavioral changes in obesity and eating disorders. Written by Jim Colajuta. Narrated by Jim Chappell. Chapter 1. Obesity's Social and Medical Implications. Obesity has become a significant problem during the last 2 decades, particularly in Western and emerging countries. The World Health Organization highlighted the fears of a global obesity epidemic and how it could be avoided in their lengthy report in 2000. These fears have been echoed and amplified by the subsequent wealth of national and global statistics and publications, all attesting to the scale of the obesity growth rate. The WHO predicted that in 2004, 1.6 billion people worldwide will be overweight, with at least 400 million obese. These estimates would climb to 2.3 billion and 700 million, respectively, by 2015. Obesity is, without a doubt, a severe health risk for a large number of people. Obesity contributes to coronary heart disease, primarily by being associated with risk factors such as hypertension, hyperlipidemia, and impaired glucose tolerance. People between the ages of 22 and 24 are 5 times more likely to have hypertension than their no-overweight counterparts. Similarly, these young obese people were more than twice as likely to have elevated blood cholesterol as their no-fat friends. Obesity is a crucial risk factor for non-insulin-dependent diabetes mellitus, the third leading cause of mortality in the United States. The National Committee for Health and Science estimated in 1986 that about 6 million Americans with recognized diabetes diagnosis. The American Diabetes Association thinks there are up to 5 million people with undiagnosed diabetes. According to a study conducted by the American Cancer Society, cancer risk increases according to the patient's weight. Obese people had a considerably higher cancer death rate when compared to a control group of average weight people. Cancers of the colon, rectum, gallbladder, breast, cervix, endometrium, uterus, and ovary were the most dangerous. One of the most prevalent concerns associated with obesity is chest discomfort, caused by stomach acid entering into the esophagus and creating heartburn. Furthermore, the weight of the abdominal fat presses on the stomach in obesity. A hiatal hernia occurs when the stomach pushes partially through the diaphragm. Obesity causes the liver to release an abnormally large amount of cholesterol into the bile. When there is more cholesterol in the bile than can be dissolved, the cholesterol crystallizes and can form gallstones. They can also cause gallbladder cancer. Humans have long and poorly formed spines, making them prone to low back ailments. Obesity strains the lower spine and makes people more prone to low back discomfort. Discrimination in the workplace and psychological stress. Aside from physical health issues, obese persons face social discrimination and psychological hardship as a direct result of their obesity. The problems range from a lack of self-confidence to severe body image disparagement, which is accompanied by emotions of self-disgust and personal inadequacy. There is a substantial prejudice against the obese in this country, regardless of age, sex, race, or socioeconomic status. The many causes of obesity and overweight. It is vital to understand the causality and etiology of weight increase to design appropriate and practical individual and group weight management programs and achieve long-term
Sample complete. Ready to continue?